Hey guys, so today in this video we are going to see the simple IV cannulation insertion technique. So we are having like 7 steps. First step is prepare. We should have a tourniquet, we should have the IV cannula, and we should have the chlorhexidine solution, and we should have this gauze piece. So second step is apply the tourniquet just 5 to 10 centimeter above the site where you're going to put the cannula, and ask the patient to make a fist. I usually apply the tourniquet here and ask them to open the fist and close the fist like for like 10 times, so that the vein becomes prominent there. So after the vein becomes prominent, you have to clean the site over which you're going to put the cannula. So you can use chlorhexidine solution for cleaning. And the next step is the insertion of the cannula. So this is very important step. You have to hold the cannula. See, if this is the surface, you have to hold the cannula at 15 to 30 degrees. So if this is my vein, I'm going to hold the cannula like 15 to 30 degrees to it, so that I will puncture it. Imagine the room which you are there as the vein, and a rocket is coming and hitting the room at 15 to 30 degrees Celsius as the IV cannula. So hold the cannula with bevel up, and so bevel is this hole in the tip of the IV cannula. It should be up, and we should insert the cannula at 15 to 30 degrees. So this is a critical step. So once you go through the skin, subcutaneous tissue, and then when you hit the vein, you will suddenly see a flashback in the back of the cannula. There is a flashback chamber. So blood appears in this flashback chamber. So as soon as you see this flashback chamber, what you have to do is you have to lower the angle. You have gone and hit. That is, the rocket went and hit the room at 15 to 30 degrees Celsius. But you're advancing it in the same angle, then it will go deep. So what you have to do is you have to lower the, since it has already hit the vein, you have to lower the angle to 0 degrees. Now you have to advance the catheter by withdrawing the needle. So by this process, the catheter will go inside the vein. As you can see here, this is the vein, and the catheter will go inside the vein. After hitting the bevel has come to the vein, then we are lowering the angle, and then the catheter will go here inside the vein, and the needle will be removed. So as the final step, we have to secure and flush. So now you release the tourniquet and flush the cannula with the saline. Now you have your 16 or 18 gauge cannula ready in the patient. So this is the first step you have to learn in anesthesia residency and as any medical professional. So I have simplified all the steps of IV cannulation into this 7. First, you have to prepare the vein, apply the tourniquet, clean the site, insert the cannula. Once you see the flashback, you have to advance the catheter by withdrawing the needle. You have to secure it with a proper fixation, and you have to flush the cannula. I have received many difficult cannulation calls, and after I go, the nursing officers present there would tell me that they have tried all the veins. They have tried with the senior nursing officer present there, but they couldn't secure. But I go and then I put it in the first attempt, and they will be astonished. The only reason I was able to do it is because preparation. They were not preparing the vein before inserting the cannula. So whenever I go, I search for the better vein and I prepare that. A good anesthetist prepare the vein before putting the cannula. You should not be overconfident and go and prick the vein, because you should prepare it. Then only the cannula will go and get fixed inside the vein, or else it will be difficult for you if without preparation. So you should follow all the steps of IV cannulation insertion. Preparation: apply the tourniquet, clean the site, insert cannula. After you see the flashback, advance the catheter, secure and flush.